in compliance with FCC regulations, is prohibited from exercising control over the content of independent, member-produced public access programming.
Welcome to Faces of South Asia. I'm Isha.
And I'm Sophie.
We welcome you to join us in the Human Trafficking Awareness Summit held right here in Quincy, Massachusetts, in the United States of America in 2016. Human trafficking is a global trade of humans, most commonly for the purpose of sexual slavery, forced labor, mostly fueled by poverty, gender discrimination, and runaway individuals. This may also include forced marriages and child marriages. Human trafficking has been reported in all 50 states, including Washington, D.C., and U.S. territories. FBI estimates about 100,000 to 300,000 are trafficked here in America today. 17,000 to 18,000 are trafficked right here in New England, and Massachusetts being their prime destination. Many victims are not runaways or abandoned, but are from good families who are coerced by clever traffickers. Human trafficking is a $33 billion industry, which ranks second to the drug industry today. Human trafficking is today's modern-day slavery. Join me in the awareness and the action taken by U.S. Department of Homeland Security, Mr. Peter L. DiMaggio. His insights are priceless. Join me in the tireless action and vigilance of the Abolitionist Network Director Sarah Dunham. Join me in understanding the slavery behind consumer products in the Free Trade Campaign by Alexandra Carroll. Join me in the incredible service provided by the Freedom Clinic of Mass General Hospital and the doctors. Join me to understand the incredible service by Amira, Executive Director Stephanie Clark. Join me in thanking the play Body and Soul. Join me in thanking Allison Cruz, who works with real kids. And thank you, a special thanks to the Rivers for hosting the Trafficking Summit in Quincy, Massachusetts, and Mayor Thomas Koch. Join me in the incredible service provided by the Freedom Clinic of Mass General Hospital and the doctors.
Good morning, everyone. My name is Moitri Guha. I am the program manager at the MGH Freedom Clinic. I'm also the director of operations at our Division of Global Health and Human Rights at Mass General Hospital. And I'm here with Dr. Riley. Would you like to introduce yourself?
Good morning. My name is Andrea Riley. I trained in internal medicine and pediatrics at Mass General Hospital. I really enjoy working at the MGH Freedom Clinic, where I've been for a year now. I also do a primary care practice for children and adults, and before coming to primary care, I did international work with children, pediatric patients with AIDS in South Africa, and work with children with disabilities in India.
Right, so today we're going to talk to you about human trafficking in the healthcare community. We will discuss kind of human trafficking in the public health framework and talk about the role of the health sector in really helping victims with the healing process. And finally, we'll talk to you about the Freedom Clinic and some of our goals. So human trafficking is a really form of modern day slavery. It is when someone benefits from the control and exploitation of the others through threat, use of force, or other forms of coercion, abduction, fraud, or deception. Human trafficking is diverse. It affects foreign nationals, citizens, adults, children, men and women from all socioeconomic backgrounds, religious and cultural backgrounds. Human trafficking currently affects about 20.9 million persons worldwide. It is reported that it's about a $150 billion market annually. And of course, in this field, reliable data is hard to come by given the illegal and often invisible nature of trafficking. Individuals can be trafficked across states, in a community, and within a person's neighborhood. About 36% of traffickers are actually considered immediate family members, so a mother, father, brother, sister, spouse. In 2008 to 2010, this is data from the US, about 83% of confirmed sex trafficking victims were US citizens, while 95% of labor trafficking victims were undocumented or qualified aliens. Among sex trafficking victims, 87% are victims under the age of 25. So sex trafficking disproportionately is affecting our children, adolescents, and youth. And this, of course, has long-term detrimental effects on not only the victimized individual, but also the family and society as a whole. And often these children are not able to cognitively or emotionally develop due to their traumatic experiences, which leads to various physical, mental, and health outcomes that are often quite negative in affecting their lives. While majority of sex trafficking victims are women, men and transgender are also affected by sex trafficking. So we have come across various studies that have shown certain risk factors to leading to a higher susceptibility of victimization and human trafficking, but are in no way deterministic. So these include runaway and homeless youth, maltreatment as a child, victims of domestic violence, sexual assault, war, conflict, social discrimination. We've also found that immigrant, Native American, and LGBT youth are at higher risk of human trafficking. So over the last 15 years, we've certainly come a long way in this arena. We went from about 3 states to all 50 states having passed and implemented anti-trafficking legislation. There are numerous task force, law enforcement, and community organizations now that are working together to assist these victims, as you've all heard today. And there are various local leaders and faith-based organizations that have established victim assistance programs to really enable our survivors to rebuild their lives. But human trafficking does remain an issue in the U.S., and we do need a more robust public health framework to eradicate human trafficking. This could include better targeting of public awareness and prevention campaigns, going beyond the criminal justice and social service response, and really encouraging cross-sector collaborations to involve the healthcare community, so we can really be at the various touch points to really intervene with these trafficking victims and survivors. And one very important point is really empowering our survivors of trafficking, because their voices are really critical when it comes to developing community-based programs and government policies to really affect change. And lastly, investing in research and strengthening our data collection. So really understanding how to better customize our intervention, because it's not a one-size-fits-all. There are various reasons why someone is trafficked at the end of the day, so really thinking about how to customize our interventions. So based on a Lederer and Wenzel study that was done in 2014, it was reported that up to 87.8% of trafficking survivors that had encounters with healthcare professionals. And this is an important finding because it really demonstrates that healthcare providers do have a small window of opportunity to really intervene and mitigate the effects of human trafficking. The report did state that these victims were not actually identified as human trafficking during their encounter, so as easily as they came in, they walked right out the doors. So, within Mass General, Dr. Wendy Macias has really pioneered a human trafficking initiative where she trains healthcare providers in identifying red flags and being able to provide more trauma-informed care. And so I will hand over this to Dr. Riley now to walk us through some goals of trauma-informed care.
So the previous slide is really telling because this is where we have to do a much better job of educating the medical community to pick up on the clues so that there are times we could help. And many times in an urgent visit, in an emergency setting, there may not be the time or the resources to fully intervene, but if we can somehow transmit the information to the patient that that there are opportunities for help, that's really the moments in time that we have to take advantage of. So that's one thing that we're really working on, is trying to teach other doctors and nurses how to pick up on the clues, because they're not readily available all the time. When we talk about trauma-informed care, there are certain goals that are very important. One is really to reduce re-traumatization. These people have been through so much that being in a setting like an institution at the hospital can be very frightening. They've been taught not to trust authority. They've been lied to so many times, things like that. So it's a very often challenging thing to repair that relationship and to find trust. So we need to be very gentle in many ways, not just physically, but with our voices and with the way that we approach taking care of them. We want to obviously promote healing and recovery. And the next thing, the biggest thing, is highlighting their individual strengths and resiliency. We want to empower them. We work with a wonderful psychiatrist who's part of our team, and one of the things he's always telling us is that when you have a story in front of you that's traumatic and horrible, you want to end that conversation with saying to the person, what is one thing that's good in your life, or one thing you enjoy, or one thing that you're good at. Trying to pull in something positive, anything, so that you end with hope rather than despair. We also want to support the development of healthy coping mechanisms, and then understanding the behavior, asking in a very open way, what happened to you, instead of the more blaming way, what's wrong with you. And then manage our own reactions, because that is so key. We talk about, the anxiety one feels can spread to someone else. The agitation can spread. Same thing, the calmness can spread, and I'll talk more about that. So in terms of picking up on these victims, we want to, first of all, have a high index of suspicion so that we're aware. We want to be able to have a private and confidential conversation with the patient, and also explain the limits of confidentiality. When that comes into play is when there's a patient who's a minor. Because of our mandatory reporting laws in Massachusetts, that if I see someone who's under the age of 18 that I'm concerned is neglected or being abused, I'm mandated to report that to DCF. So if someone comes in looking thin or malnourished, we often think eating disorder, but it could be just a simple deprivation situation. Mental health is definitely one of the bigger categories. We see somatic syndromes, so people in the long-term care that I'm now taking these patients, fatigue, chronic headaches, persistent pain syndromes, because the body wear, the way that the trauma comes out is with these symptoms. Almost everyone that we see suffers from depression and PTSD. They have difficulty sleeping, often recurring nightmares, and this is why we work hand in hand with our psychiatric colleagues to take care of these patients. Suicide, that should read also suicidal ideation, because many of these women may not commit suicide, but they often think of it often as their only way out. And then substance use disorders, and this goes hand in hand. Sometimes it's what led them into trafficking in a way that they started using drugs as a 13-year-old, started with pills, escalated to heroin in the end, and then in order to pay for the drugs, agreed to have sex for money and then get entwined. So that's a situation where the drug use started first, but then in other situations, it's something that the pimp uses to enslave the victim and still will start her on a habit that she didn't have before. But that's also a chronic problem that we are now dealing with. We work hand in hand with one of the substance use clinics at the hospital to deal with this as a problem. And it makes recovery hard. It makes dealing with the trauma hard when you're also trying to deal with addiction. In terms of sexual health, of course, there's sexually transmitted infections. Many of these women are forced to have sex without condoms. And then related diseases such as HIV/AIDS, hepatitis C has become a chronic condition for many of them. Then we see unwanted or high-risk pregnancies. Again, there's that not only forced to have sex without protection or a condom, but also the absolute immaturity of these patients. Again, some of them have been in the system since they were 13 or 14. They don't have a mature way of thinking about things. They don't think about responsibility or act. So even when they're out of the life and in a safe house, they will have unprotected sex. They don't think about consequences. So we see that happening. And then we are forced to help them deal with the situation next of the unplanned pregnancy and what to do. Some of them have already undergone forced or unsafe abortions and the complications from that. And then unfortunately we do see trauma to the genital area when people have been not only forced to have sex, but also they've been instrumented with other objects. In terms of occupational health, we see simple things like fatigue from excessive long work hours, but also because they've been either exposed to chemicals, not having protective eyewear or hand wear. We see chemical burns on the hands, physical abuse in that setting as well, eye complaints, sore muscle strains and fractures from repetitive motion. One of my patients pulls cable, and she's been pulling cable for years. She works for one of the electrical companies, and she's not a victim of trafficking, but she's just someone who's in her 70s and has done this job for more than 20 years. She has a method that she pulls with her right hand and steps on the pedal with her left. And she has chronic knee problems on the left and chronic wrist problems on the right, and it's just because of this repeated action for years and years and years. And then signs and symptoms of dehydration. So in terms of setting the scene, we in the hospital or in the clinic want to provide an environment or a setting that is trauma-informed. And what that really means is something that is soothing, calm. The location of our clinic is quiet. There's not a lot of other things going on. That was selected purposefully, so it wouldn't be in a busy place with many people coming and going. We offer something that's pretty unique in medicine. I'm new patient appointment is 1 hour long, and we just sit and talk about whatever the patient wants to, and that's really unique to have an hour to sit and not feel rushed. And I always tell my patient that, you know, I'm going to be your new doctor, and this is just the beginning. I'll see you again. So it feels like we don't have to get everything done today. It's something that we're just beginning. So it's a nice opportunity. I'm dealing with these terrible stories, but I also feel like this is the most beautiful part of medicine, is developing relationship. So the 4 C's to have a calm environment, and this is very important. Some of the literature is about caring for the caregiver and paying attention to how we feel when we walk into the room. And as I said before, like a nervous or agitated caregiver can also suggest that to the patient. So the calmer and more grounded I can be when I walk into the room, I think that helps set the tone. We also, very importantly, contain. We are not, as I said before, there to disclose. We're only going to ask the level of detail of the trauma that will allow the patient to maintain their emotional and physical safety and respects the time frame of the interaction. That's very important, because if you know you are actually only there at that moment for an urgent visit, they've come in for a sore throat or something like that, it's very important to really stay focused on that. You can't delve into the trauma history if you don't have time for it. You do want to, as I said before, give them the opportunity to come back, but it's wrong to start something you can't finish, and it leaves the person more damaged and feeling worse when she walks out the door. Care, we talked about self-care and also compassion in the way we approach these. Again, this needs to be blameless. This is not her fault, and you can't ever convey that that's how you feel. And then coping. Emphasize coping skills that build upon strength, resiliency, and hope. These are survivors. The person in front of you has gotten here and lived through some awful experiences, and that is really what I try to stress, is like, you're amazing. You're here now. You're alive. It's fantastic. Go forward. So, again, the formation of a healthy, respectful, trauma-informed relationship is the priority. Behavior changes are slow. And then focusing on the resiliency and empowerment rather than disease outcomes is often the most effective intervention. We're dealing with so many things with these patients. We're dealing with the past trauma, their subsequent PTSD, their chronic pain issues, their ongoing hepatitis or HIV infection, their current smoking habit. They may be still currently using other drugs or substances. So there's many, many things that we're taking care of. And one of the things that we also realize is that this is not only long-term, but it's multi-disciplines, so that we are building a network to take care of them. And we are focusing on not just primary care, but now we are getting our colleagues in the hospital in different specialties to help us with different areas that we need. There are guidebooks here on the side table. This is for those of you who want more information. This is put together by Dr. Wendy Macias Constantopoulos, who's our medical director, and then her team for the Human Trafficking Initiative group, both at MGH and the Mass Medical Society, on a guidebook for healthcare providers on identification, assessment, and response in the healthcare setting. It's also available online as a PDF if you want more information. So, transition back to my treatment.
Okay, so now we're going to kind of switch gears and talk more about the MGH Freedom Clinic. So the MGH Freedom Clinic would not have been possible without the support of Partnership for Freedom. It is a public-private partnership that led by Humanity United. They're really dedicated to promote innovative solutions to end human trafficking in the US and beyond. Back in 2014, we applied for a competition And amongst 162 proposals that were submitted by 260 organizations across the U.S., we were one of 2 winners of the grant competition. The MGH Freedom Clinic is an unmarked, referral-only clinic providing free primary, preventive, and mental health services to victims and survivors of sex, labor, and organ trafficking, ages 13 and above. It was established last year in April, so we just had our 1-year anniversary. Our 3 major goals include offering strengths-based, trauma-informed approach to patient care, as Dr. Riley walked you through, and really empowering and encouraging self-care behaviors and letting our patients know that you're worth it. You're worth having health care. You're worth being able to rebuild your life again. We also conduct health needs, outcomes, and best practices research. We do epidemiology and pathology of human trafficking. And finally, we streamline mechanisms for cross-sector referrals. So this includes local, state, and regional networks. And just ultimately, our goal is really to be able to provide holistic care with a focus on healing and recovery from the trauma. Our Freedom Clinic offers services in a safe, trauma-informed, LGBTQ-friendly, and judgment-free environment. We offer free primary and preventative care, annual physical exams, vaccinations, medical clearance evaluations, mental health services, addiction services, infectious disease testing and treatment, as well as referral to a trusted network of trauma-informed MGH subspecialists for more specialized care. The Freedom Clinic providers and staff currently include our medical and executive director, Dr. Wendy Macias, who's also our case manager. One access nurse, Leslie Carabello, she's here with us today, and she will be part of the roundtable discussion. 5 MedPeds providers, one of which is Dr. Riley, 4 mental health providers and social workers, Joanne, who's also here with us today and will be part of the roundtable discussion later. 1 program manager, myself, patient financial services staff. So MGH has kindly been very supportive of the Freedom Clinic, and these patient financial services staff really help any patients that are uninsured get connected with Mass Health or find other means of insurance. An expanded network of Freedom Clinic preferred MGH subspecialists, case management services. So of course, healthcare is only one piece of the puzzle. Most of our patients will need some sort of legal services, law enforcement services, or immigration services. So we're continuously building that network of trusted referrals for our patients. And a board of advisors that also includes one of our survivors and one of our current patients who is really an advocate in the field right now. So it is very important to us to be able to offer quality and comprehensive health care to our patients. So in addition to the primary and preventative and mental health care that we can provide within the 4 walls of our clinic, we're also building a network of trauma-informed providers, and this includes services in gynecology, surgery, urology, physiatry, rheumatology, gastroenterology, infectious disease, mental health, and addiction. Through the past year, we've definitely found that mental health is a very large unmet need of this population. So we continue to build our capacity to offer our patients quality mental health services at the Freedom Clinic. So who can refer to us? So any individuals and organizations that work with or help exploited individuals. So this includes federal agencies such as the FBI and Homeland Security. It includes state and local government agencies, safe houses, youth and adult services, and really any anti-trafficking organization who's working on the ground.
Doctors too.
And doctors as well, yes. Absolutely. So for Freedom Clinic referrals, we ask people to contact Leslie Carabello, who again is here today with us, or Dr. Wendy Macias directly. and we have their email and contact information. Or feel free to come to either myself or Andrea later today for this information. As many of you probably know, the National Human Trafficking Resource Center is a 24/7 hotline. A lot of our healthcare providers can also use this line to learn more about the resources out there for this population. And I think that's it.
Of human trafficking in a faraway land is really not true, because it's right here in New England, in Massachusetts, in United States of America. We thank you to join us in this difficult, heartbreaking human trafficking awareness, action and solution summit in 2016. We hope that we can make a difference. Join us in our campaign. Thank you.
Thank you.
I'm Isha.
And I'm Sophie.